brown and black doctors have the best of intentions, but there are also doctors of other races that have the best intentions as well. But sometimes it really is stemmed from the way that they were taught and just the system that we are in, why we have to go in and like almost have like a level of expertise of our care and ourselves that other races or other groups of people may not have to.
Yeah, I'm actually so glad that you brought that up because like there are two issues there. One, I also want to say just because you have a doctor of color or a healthcare professional of color doesn't necessarily mean that person is necessarily going to be understanding or see you as a full human being, because when you go back to it, I think about like how I was educated, trained, socialized, in essentially a system that there is racism, there is sexism. So that's how I was trained, right? And I was when I was in medical school, the curriculum was very different than it is now. I mean, it's changed, but there's a focus on health equity. There's a focus on the source of racial health inequities. There's a focus on the social determinants of health. There wasn't that when I was in medical school. So as a practicing physician, I've had to learn that on my own, but that's also because of who I am, my lived experience as a Black woman, knowing that I have to do this. But what about all of the other healthcare professionals that are out there, right, who didn't get that education, that have this gap and don't even realize they have that gap in knowledge?
Yeah, 100%. Yes. And I mean, I'm sure we'll get into this as the conversation goes on, but that also goes back to like making sure that you're well aligned with your provider, which isn't, I would say that that's a luxury still for a lot of people. But yeah, it's like we're talking about life or death here. Like we hear about so many cases of Black women, especially going in for a pretty tame condition or a condition that would normally not yield a mortality, and they either don't make it through,
right,
or they're
yeah.
like dealing with something out of the ordinary.
Yeah, it's so interesting because when you bring that up, one thing I was thinking about recently, and I know you're like, where are you going with this? But I was thinking about how even police stops with Black people, it escalates really quickly, and it's like, wait a minute, but I just got stopped for a broken headlight, and then you find like the person was just killed. Like what just happened,
Yeah.
right? And so it's the same where I think with maternal mortality, for example, like so many of the deaths are preventable. So many of them happen in young, healthy birthing people, right? So then you ask yourself, well, what is going on, right? Like, why? For example, here I'm in New York City, the rate is even higher of complications for Black women. It's 8 to 12 times as much for white women.
Yeah.
In New York City, right? So you have to ask yourself, like, why would, and I don't know if you saw that the Hulu documentary.
Aftershock, yes. Yeah.
Yeah, I mean,